Oh yeah, got it.
Beautiful. So one more minute and we will start. Brianna, I'm not sure if you can hear us. I can see it's still trying to connect to audio. But good luck connecting to audio. I have no idea how to fix that on this end.
I'm not sure on my end either.
All right, 6:35. Let's kick it off.
Woohoo!
Thank you everyone for joining us live. I know there'll be a lot of people watching the replay of this as well, because that's how life works. I am Emily, and joining me is Emily Rose, one of the wonderful us in our clinic. Emily Rose has been with us for a couple of months, and she has a lot of experience as a skin specialist naturopath with a background in working in skin clinics and doing actual skin therapies. But obviously her passion as a naturopath lies in doing all the internal work, which is something that we focus on and specialize in at the Acne and Eczema Clinic. Emily Rose is also a trained corneotherapist, so there is a lot of knowledge that she holds that is quite different to people who are just a naturopath. I know saying just a naturopath is not really polite, but when it comes to skin, there is so much more to know, and that's where obviously all of this specialist training that both of us have a background in really does make a difference in being able to get to the core of what's actually going on with your skin and being able to make a difference. So my name is Emily Banks. I'm a naturopath. I've been a naturopath for 10 years, 10 plus years now. And I founded the Acne and Eczema Clinic a couple of years ago, ironically during COVID, which was crazy times. But I did that because I'd been working as a general naturopath for a very long time. And as a naturopath, I think one of your callings is finding what your calling actually is as a naturopath. And for myself, that was working with people with acne and seeing truly how much that can change the confidence of a woman. And also working with people with eczema and seeing how much that can change the trajectory of their entire life in being able to, you know, avoid reliance on steroids and being able to obviously overcome a lot of debilitating conditions, which acne and eczema are both one of those things. So welcome to the Acne Masterclass. In our masterclass, we're going to be discussing all of the main components that we look at as internal drivers that the general public is really not aware of. But obviously, so many of you are looking for those answers and for that information. And I think this is part of the problem in trying to find the answer for yourself, is that anything that you read on the internet is usually biased towards selling a product at the end of the article, or leading to another service or something at the end of the article. So that information is not always actually really helpful in our own personalized journey. And the thing that I have found as the real key in being able to make a difference in people's skin is actually understanding what those unique internal drivers are, being able to educate people about that so that they have more control over the outcomes of their skin and the paths that they choose to clear their skin. And also, most importantly, being able to teach you about all of the factors that you personally need to pay attention to be able to maintain amazing results with your skin. Because as much as acne is a condition that affects a lot of people, there are no two people that receive the same treatment in our clinic, and that's because we work with personalized internal drivers and personalized treatment plans, and that's why we get the amazing results that we are known for. So the entire point of this masterclass is to help to educate you about some of the things that can make a difference in helping you get off the merry-go-round. And I'm sure that we are all familiar with the merry-go-round. Below, we've got some before and afters of someone who was very much on that merry-go-round, found us, and has amazing skin now. When we're looking at acne as a condition, In conventional medicine, there are only certain medications that we're offered and certain treatment routes that we're offered. And unfortunately, they're not always very successful. And this is because they're also not looking at your personalized drivers. So when we look at the main sorts of options that we're offered when it comes to treating acne and seeing a GP or a dermatologist about these conditions, these are generally the options that we're given. Usually the first line of treatment is antibiotics, whether that be doxycycline or something more intense like erythromycin if you've reacted to doxycycline. Antibiotics are usually the first route of treatment. And this is, in my opinion, a very rudimentary way to look at acne, because it is only looking at the very last thing that happens, which is bacterial overgrowth on the skin. A million things happen prior to that to encourage bacterial overgrowth, but antibiotics are most commonly prescribed usually for a month, sometimes at a lower dose for years at a time, to try to manage the bacterial overgrowth of the skin. And for some people, they can actually make the condition worse. For other people, it can help the condition, but obviously as soon as you stop the antibiotics, then you're faced with acne again, because the antibiotics have not actually treated anything underlying that's contributing to acne. One of the most important things I think to bring up in regards to this being the first route in conventional medicine is that it is going to become an epidemic, that there's going to be bacterial infections that we can't treat anymore with antibiotics, because we're given antibiotics just willy-nilly for conditions that really don't require it. So as much as sometimes there is an instance where antibiotics are very necessary, for example, if staph is happening over your acne or conditions like that, then totally antibiotics can assist for a short period of time, but they do leave in their place other damage, especially to our microbiome, sometimes also to deficiencies of nutrients that are inhibited whilst we're taking antibiotics. So we're kind of taking one thing and leaving other problems in its place. So not a holistic answer. And obviously, once you stop it, the problem comes back. The other thing that's usually prescribed once you're given antibiotics is topical antibiotics as well. So common things like Benzac or compounded creams that have antibacterials within them. These can be quite harsh on the skin and the barrier, which is something Emily Rose is going to go a little bit deeper into in a moment. But harsh topicals can actually contribute even further to barrier compromisation, which is already an issue when we have acne. So it's really important that we're able to avoid things that are going to create more problems in their place when we're treating something like acne. The other thing that I'm sure most of you are familiar with is the oral contraceptive pill being prescribed for acne. And usually this is given at the same time as antibiotics. If not, then it will be given alongside the prescription of Accutane, because you cannot get pregnant whilst you're on Accutane. So if you do go down that route with a dermatologist and you're given Accutane, you're usually given the oral contraceptive pill at the same time. If not given the oral contraceptive pill, other common hormone replacement therapies include IUDs or spironolactone, which is quite targeted to aggressive acne, where testosterone dominance is a really big contributor to it. So these sorts of medications obviously create even more havoc in the body, and is something that I think a lot of people, especially younger generations, are now a lot more aware of, and don't want to go down that route of suppressing all of their hormones in favor of having clear skin. The obvious issue here is the same as all of the other options that we're given, which is that these medications are not treating the cause. And most importantly, they're actually not even educating you about what the cause is. So we basically choose to utilize the oral contraceptive pill to suppress all of our hormones that could be contributing to acne. But once we come off the oral contraceptive pill, guess what? All the problems come back. Any hormone dysregulation that the oral contraceptive pill has been prescribed to fix will come back, because no work has been done to actually try to rectify that hormonal issue. We can also then deal with massive problems like post-pill acne, which is something that we'll go a little bit deeper into as well, because so many people have been on the pill to try to clear their skin. Accutane is one of the other harsher medications that is prescribed for acne. And in my professional experience, this is given, and the pill is given way too quickly to people who are also way too young. And Accutane is a very harsh medication as well. It can trigger off eczema, it can trigger off allergic reactions, it dries everything out. So once again, it's not actually treating the cause. It's not helping the true driver that's contributing to the acne. And as much as some people do have amazing results, and there are some people who, you know, will go better for being on Accutane if they have very, very severe conditions in their skin, and natural therapies is going to take a long time to fix. Accutane is really not actually treating the cause. It's just drying everything up and removing the possibility of there being bacterial overgrowth or sebum production at all. There's also a lot of different side effects that can occur with Accutane, including obviously most people being aware that it can increase mental health issues where you have a predisposition for that. Most importantly, none of these things are actually treating the cause, and none of these things are even telling you what the cause is. And in my opinion, understanding what the actual problem is what helps to free you from the concern and the stress about why you're experiencing acne to start with. So our entire purpose is to help you get off the merry-go-round and to understand that there are individual and personalized factors that are going to be impacting your skin. And these are some of the things that we look at as practitioners in the Acne and Eczema Clinic to be able to help to uncover what you need to change and what you need support with to be able to get clear skin that actually lasts and doesn't come back as a complete nightmare of a problem as soon as you stop taking things to address it. So this is my clear skin formula, which I have developed over the last decade of being a naturopath. And this helps us to compartmentalize all of the things that otherwise seem quite abstract when it comes to holistic health, but helps us to be able to isolate what factors are really specific for you and what factors actually need support, so that we can continue to educate you about how to firstly change those drivers and then maintain those improvements. And also so that we can actually rectify any imbalances or dysregulation that is happening. So there's quite a lot that we look at, obviously, but we're going to talk you through some of these common internal drivers so that you have a better understanding of what things might be driving your acne, and so that you can also get the right support that's going to give you results that last. Hand you over to Emily Rose to talk through a little bit about different sorts of acne and also some of the first drivers that we look at, which are common for everyone with acne.
Hey, let's get into it. So when looking at these 4 photos and even our own skin, we can see that acne takes many different forms. On the left, we have non-inflammatory acne, so open and closed comedones, so they're commonly known as white and blackheads. And then on the right, we have inflammatory acne, which involves pustules and cysts, where we can see lots of redness and inflammation. There can be pain, heat, and there can be pus present. The type of acne that you're experiencing, it gives us really good insight into the potential drivers. Location's also really important to consider. Different parts of the face versus different areas of the body, whether it's the chest, the back, shoulders. The severity of your skin condition can also determine how likely the driver is to be internal, opposed to just a skin barrier dysfunction from, let's say, topicals. So let's dive in and start talking about the first driver for anyone who has acne, which is the skin barrier. Our skin barrier is responsible for so many functions that we need to support for healthy, happy skin and to help reduce acne. A healthy skin barrier has regulated oil and water. It's got reduced oxidative stress. There's no inflammation, and it can naturally decongest and exfoliate itself. Our skin barrier is also influenced by genetics. So for example, the size of the sebaceous gland that excretes oil, it's determined by genetics. So we need to take all of those factors into consideration when we're evaluating your skin barrier. So now we know what like a healthy skin barrier looks like. Let's talk about what's happening to the skin barrier if you are experiencing acne. When the skin barrier is compromised, we can observe changes in oil production. Now, I don't want to demonize oil because we want lovely free-flowing oil. We want that oil to lock the water in within our skin so it's nice and hydrated. However, we've got drivers that can change the quality of the oil that our skin's creating. So that could be genetics, it could be hormones, and that oil can become really thick and pore clogging. And then this results in congestion and blockages within the hair follicle, leading to acne. We can also see oxidative stress and inflammation, and that starts to look like red, hot, painful pustules and cysts. Now, when we think of bacteria, I know a lot of us think about the bacteria within our gut microbiome, but our skin also has its own microbiome, which is really exciting and very fascinating. We've got things like P and C acne bacteria, which play a big role. But then we also have to identify any secondary infections or bacteria such as staph and candida, which can disrupt the skin microbiome and the skin barrier as well. Our skin barrier as a whole, it loves nutrients, so we need to make sure we're addressing any underlying nutritional deficiencies as well that could be impacting its function. Which leads on perfectly to another internal driver, which is nutrition and nutritional deficiencies. Our skin loves and thrives on balanced levels of A, B, C, D, E, zinc, and fish oil. I almost need to sing the alphabet there. Your skin barrier's unique requirements for these nutrients is determined by lots of factors. So for example, we have the gene called the filaggrin gene deficiency, which governs how much fat and essential oil your skin needs to be able to work at its optimum. In this case, as clinicians, we really need to dive into a client's family history to determine if that genetic predisposition is contributing to a client's skin nutritional needs, because your demand and need for those essential fatty acids will be higher opposed to someone else. Now, when we're in clinic, common problems that we start to see when we're talking about nutrition is diets really high in sugar, which can impact insulin and your blood sugar levels. Diets that are low in fat, so that, as you can see, would be a double-edged sword. If you're not eating a lot of fat, but you have the genetic predisposition of issues with the filaggrin gene deficiency, those two things, they don't mash together, so we need to identify that. Undereating is another really big impact because it can change your hormone production. So what do? Number one, testing for your insulin levels. Number two, looking at dietary analysis of what you're consuming. And then lastly, also, if it's relevant, testing markers that would indicate any undereating that's causing changes in hormones and brain function and how they're communicating to each other. Back over to you, Emily.
Let me unmute myself. So our next driver there is hormones, because undereating is actually, something that we see more commonly than overeating in the clinic, contributing to hormonal issues. So it's really beautiful to tie in some of those components of everyday lifestyle and how it actually can have a more pronounced impact on the hormones. Now, I think everyone is quite familiar with hormones as a driver. And most people have probably done a lot of research around their hormones and assuming that their acne is hormone relative. Yes, hormonal acne is very common, but so is acne that is not driven by hormones. And it's really important to understand some of the complexities behind your hormones and the fluctuations that occur throughout the month so that you can actually see if hormones are an issue. Now, when we're looking at hormones, obviously throughout the monthly cycle, provided that you're not on the pill or any sort of hormone suppressing medication, we do have massive fluctuations of hormones that occur at particular times throughout the cycle. And that's assuming that you have a regular cycle. If you don't have a regular cycle and you have a condition like PCOS, or if you're under eating and you therefore have elongated cycles, or you have a thyroid issue or whatever it might be that impacts your hormone production, then it is more difficult, obviously, to see those obvious correlations with a normal cycle and normal fluctuations and how that ties into your skin presentation. But generally, what we see as practitioners is that if there is a strong hormonal driver, there usually is a time in your cycle where your skin is much worse. I think the problem here is that with general education, all that we're told is testosterone and androgens drive acne. Therefore, we don't consider estrogen, we don't consider our ovarian hormone production, and we're only really looking for testosterone as a driver. But to be quite honest with you, testosterone does fluctuate throughout the cycle, so it does increase at particular times. But if you have dominant testosterone levels and your testosterone levels are too high just as it goes, whether that be a genetic predisposition or lifestyle factors or whatever it may be, if testosterone is a driver, usually you have more consistent acne, and usually it is inflammatory as well. So looking at testosterone is really, really important, but it's also important to look at other androgens as well, which also impact the sebaceous gland, increase the oil production, increase inflammation within the skin. So where there is a constant presentation of acne, there's a constant driver somewhere. And if you have high levels of testosterone, that's basically going to be there throughout your entire cycle. Though, where you get clarity with your skin also tells us a lot around what hormones are responsible. So if you have a condition, for example, like having high testosterone, which should only obviously be diagnosed through blood work or some sort of testing that actually proves this to be the issue, then usually you will actually get relief of your acne at the start of your period leading up to ovulation, where you're producing more estrogen, which can help to offset the testosterone that you're naturally producing a lot more of. But having said that, testosterone is not always the main driver. In the clinic, we actually rarely see a true red flag for testosterone. When we do, it's nice and easy. We know the exact stuff to use to reduce testosterone, but usually it's actually your hormones in correlation and context to each other that causes an issue within the skin. So even if you have moderate levels of testosterone production, if we compare that in context to how much estrogen you're producing, which estrogen helps to protect the skin, it helps to regulate the oil production from the sebaceous gland, it helps to moisturize the skin and keep moisture within the skin. If you're not producing enough estrogen, then you will have more pronounced acne issues at the times of the cycle where estrogen production should be higher, but for yourself, it might be lower. And these are things that can all be contributed to, like the hormone dysregulation side of it can be contributed to by many different factors, including undereating, including stress, including gut health, including bowel health, so many different factors. But people only ever talk about testosterone. And to be quite honest, I just rarely see that as a common driver. Usually what I see is that ovulation is a big trigger for people. And this is where we're looking more closely at ovarian hormones and how they contribute to a surge in androgens, a particular cycle. Now so I just let someone else in. Now, this part of your period where you're going through the normal phases of your period and you're going through the follicular phase where you're producing more estrogen, then you're going through ovulation where your estrogen's peaking and also your ovarian hormones are peaking. Then after that, we go through the luteal phase, which is where essentially most of our hormone production starts to decline. So where you're having more aggravation throughout your cycle actually tells us a hell of a lot about what tests to do, what hormones are most likely contributing, and most importantly, at what time of the cycle we should be doing the test to find the red flags. We'll talk about testing in a moment and how problematic it can be. But another factor is also where your skin is clear, right? So if you have clear skin when you get your period, if you have clear skin halfway through your period, if you had clear skin for the first time ever when you were pregnant or breastfeeding, that tells us a hell of a lot about what hormones are responsible. So we pay very close attention in our consultations to when your skin is aggravated, but also importantly, when it's clear, if that's happening for you. For some people, it is completely constant, but there usually is some period of clarity or where there is no actives and only healing occurring. And that tells us a hell of a lot about what hormones to really focus on, because hormones are incredibly complex and complicated for women. We produce a hell of a lot of different hormones, and we also have a lot of drivers that will wreak havoc on our hormone production. Anything from not consuming enough fat, which is like the backbone of how we produce hormones, to not sleeping, to being super stressed and going through early hormone changes. There's so much to consider from a personalized perspective when it comes to hormones, which is why we're having this conversation, right? Because I'm sure if you've looked up hormonal acne, why do I have hormonal acne? Everything just points you towards testosterone. But when you're told actually your testosterone is normal, where do you go from there? There is a lot more to understand about all of the other hormones that impact your skin and all of the other hormones that also can contribute to more androgen production. And when I say androgens is just a fancy medical term for hormones that are similar to testosterone and are masculinizing. And masculinizing hormones work on the sebaceous gland. They increase oil production. So this is obviously a major contributing factor to acne, because at the end of the day, when you're producing more oil and it's not free flowing, that's where we get congestion. that's where the bacterial overgrowth can occur. So we want to pay close attention to anything that is leading to increased sebum production so that we can help to control and regulate that properly. It's also really, really important to understand that when it comes to hormone dysregulation, when I was studying, I was like, I'm going to be a nutritionist. And then I started working in the clinic and using herbal medicine, which is like my second nature as a person. And you simply cannot get hormonal changes that are dramatic without herbal medicine. So this is also why we pay such close attention to your hormone balance and exactly what support you need, because when we're using herbs to actually influence your hormone production and to help to change certain hormone imbalances within you, the herbs that we use are so specific to you and so specific to exactly what we're working on when it comes to hormones. So even when it comes to a very infamous herb called chaste tree or Vitex, Agnus castus, or monkberry, or whatever you may have heard it to be, there are plenty of people that we see in our clinic who, if we gave that herb to, it would make their acne worse, because chaste tree actually works on your ovarian hormones. It works on your pituitary, but look, I won't get into it too deeply. But chaste tree is often prescribed and recommended in articles as a hormonal balancer for hormonal acne. But if you have issues where you're actually more aggravated during ovulation, then chaste tree is going to make all of that worse, because it increases luteinizing hormone, which for, I would say, half of the people in our clinic is the major driver to their hormonal acne. So this is also why we take hormones so seriously and take the time to truly understand what your personalized hormone picture is, because even when it comes to using things like herbs, you're not going to get an efficient result from them unless they're super targeted to exactly what the problem is that you're experiencing. So hormone testing. A lot of people that I talk to are like, yeah, I think I have hormonal acne. I've seen the GP and I got my hormones tested and they said everything's fine. And I'm sure we can all relate to having a bunch of tests done through the GP and being told everything's fine, right? Now, something that is very, very important to understand when it comes to hormone testing is that when you actually get a hormone test done, there are very clear and different windows, which are referred to as reference ranges, which change dramatically, depending on what part of the cycle you're in when that test is done. So in the follicular phase, for example, at the start of the cycle, the reference range is very small. In ovulation, the reference range is massive. So if you have had hormones tested and you've been told everything is fine, my next question to you is, what day of your cycle were you on? And did anyone ask you that when they read your tests? Did they direct you to have the test done on a particular day of your cycle or not? If that information has not been collected and that information has not been advised to you to have the test done on a particular day of the cycle, there is absolutely no way that that doctor or whoever it is reading the right reference range, because you can look at the result and assume based on the result what sort of reference range you're in. So for example, if your estrogen level is like 700 and the reference range is 90 to 500, then a doctor might read it and go, oh, it's 700, so you must have been in your ovulatory window. Maybe you weren't. Maybe you were on day 2 and you have massive estrogen dominance. Like, there's no way that you can read the right reference range unless you actually know exactly what day of your cycle you are on, and also if you have a regular cycle or not. So it's really, really important to understand, if you've been told that hormones are not a driver and you've had them tested and you've not been directed to have them tested on a particular day, and no one has asked you at all what day of your cycle you are on, those tests mean sweet FA to us. You need to be tested again on very particular days of your cycle. And even when it comes to hormone testing, depending on your background and where your skin is more aggravated or less aggravated, we may direct you to have tests done on different days. We might want to see your ovulation window. We might want to see your follicular window. It all depends on exactly how you're presenting and when you're more aggravated with your skin. When it comes to blood tests as well with hormones, we can only see a certain amount of information when it comes to blood. Because when we're looking at blood tests, they're amazing and they help us to cut to the chase and see big red flags. But blood is telling us what's floating around in the blood. It's not telling us how those hormones are being metabolized or how they're actually being used and broken down by the body. So it can be a little bit limiting sometimes only to look at blood tests when it comes to hormones. This is where for certain patients in our clinic who their blood tests don't really show us enough information, we might look at metabolite testing to be able to really understand all of the factors that are contributing to hormonal acne and exactly what pathways need support, because that's how complicated hormones are, but not for people who are trained in actually being able to do this work. So what we do is we look at your hormone testing on the appropriate day, depending on where your skin is more aggravated. We also look at any pathology tests that you've already had done to be able to see, firstly, what day of the cycle you were on so that we can actually see if there's anomalies or not, and also to be able to see any trends of, for example, dysregulation that's been there for a long time. We also will then look at metabolite testing as another step for people where we don't get enough information from blood testing. And there are very few people, I would say none, and I'm sure Emily Rose would agree, that metabolite testing doesn't give us a really clear answer around what hormone pathway is actually driving the skin issue there. So if you have taken the oral contraceptive pill or you've been put on the IUD, which I would have to say probably the IUD is not as effective as the oral contraceptive pill that completely shuts everything down when it comes to skin and getting clearer skin. If you've been on spironolactone or anti-androgen medications like that, and you have gotten better skin from being on those medications, then there is an assumption that hormones are likely a driver. So this is also why your history and everything that has ever happened to you is so important for us to understand as clinicians, to really understand what your drivers are as well and ensure that treatment is efficient. Now, post-pill acne is something that I couldn't help but mention because a lot of people experience post-pill acne. And this can also be a part of some of the psychological stress, I think, of being put on the pill or whatever medication it is, stopping taking it and everything gets worse, or the problem comes back again with more vengeance. So there is a little bit to understand about post-pill acne that I hope takes a little bit of stress out of the experience if you're someone who's currently going through it, or someone who's looking at giving up the pill, or someone who has tried to do this a million times and has ended up back on the pill within 6 or 12 months because the acne is so aggressive. And usually you're advised to just do that again by the GP because they have no other medications to give you to stop it. So when we take the pill, something that I find very unsettling is that the pill basically, it suppresses all of our hormones and it takes our oil production, our sebum production from our skin back to a prepubescent level. So for most people who are genetically predisposed to experience acne, they will experience it during puberty, where their sebaceous glands get to a full size and they start to experience more oil production. So this is usually the time frame where people are then put on the pill or put on antibiotics or harsher topicals, and then they get clearer skin. Then when they're in their 20s or 30s, they want to come off it, and then the acne comes back and they're left scratching their head thinking that they're an incurable person because their acne's back. It's very important to know that any hormonal driver that you might have that's contributing to your acne will be mostly entirely suppressed whilst you're on the pill, because it shuts down your ovarian function and your hormone production from the brain down. So it's quite a intense medication in that regard. Usually, if you're experiencing post-pill acne, you'll experience it within 3 to 6 months of coming off the pill. And when you do come off the pill, those first 3 months, in my opinion, as a clinician, is a really key time to understand if you might have quite a massive underlying hormonal irregularity. Because if you don't get your period in that first 3 to 4 months, or you get a light bleed, which is really just a withdrawal bleed for the first 3 months, then it's showing that you're actually not ovulating. And this can be, for some people, it can create a bit of an elongated process to get hormone testing done, because we have to wait for you to ovulate and have your period. So usually within the first 3 to 6 months of coming off the pill is where you will experience the most aggravation when it comes to post-pill acne. For some people, up to 12 months off the pill. But in my experience, you will see it in those first 6 months, because this is where your sebum production is starting to ramp up again. And it's essentially kind of like going through puberty all over again, but without putting a pause on it with the pill. So we produce a lot more sebum, which is obviously a massive contributor to acne and to congestion. We're also producing a hell of a lot of steroid hormone as well, which, until we're producing enough estrogen, which takes at least 3 months for us to ovulate once we come off the pill and actually produce natural estrogen, until we're producing natural estrogen, we can't really offset the effects of strong steroid hormones. So there's a huge increase in the amount of hormones that are more androgenic in those first 3 months coming off the pill. And that is a huge contributor to your acne getting worse. There's also components with taking the pill that will potentially create consequences for you. So something that a lot of people don't know is taking the pill can actually cause certain nutrient imbalances and mineral imbalances or deficits. And this is why it's so important that the first thing that we do and the first thing that you think about as a person experiencing acne is, what little holes in my bucket can be filled? And were those holes created by certain things that I may have done to try to help my skin? So common deficiencies that can occur from the pill that will massively impact your skin function and health is vitamin E and also zinc. So these two things are massively decreased and inhibited when it comes to absorption whilst you're taking the pill. So making sure that those potential deficits are tested to ensure that there's a deficit and then corrected can make a hell of a lot of a difference in how your skin is presenting and how severe the acne is. Stress is also a component as well that can contribute greatly to acne. So when you're coming off the pill and there's going to be nothing to like suppress anything in your skin anymore, then all of your other drivers also become a lot more relevant, which is why we look closely at stress, at diet, and any other signs in your history that might point towards a hormone imbalance, so that we can help to sort of soften the roller coaster of post-pill acne there as well. The pill also has a massive impact on the microbiome. So I'm just going to drop that in there, leading into our information about gut health as well. So once again, it's another medication that we can take that can give us a result, but that often leaves other problems in its place. And the longer that you've been on the pill, the more problematic some of those things can be. What happens when we come off the pill? Increase in sebum production, so much oilier skin, which will lead to the requirement of different topicals to help regulate that, and also puts you obviously at that massive risk of developing acne. Increase in steroid hormones as our ovaries start to ramp up again and produce more hormones, and also hormone dysregulation that may have always been present but never tested or understood will start to come to the surface again and potentially complicate the picture. If the pill or hormone therapy didn't work, then obviously hormones may not be the main driver. Now, I do see this sometimes with people who are prescribed spironolactone, which is an anti-androgen medication, that it doesn't really do anything for them. And this might be because testosterone isn't a problem. Maybe you're actually not producing enough estrogen. So this is also why it's so important to take into account all of the hormones that we produce as women and what dysregulation might be occurring within them and in context to each other, because your amount of testosterone is entirely relevant to also the amount of estrogen that you're producing. So it's really important to look at the person and everything that's going on with your hormones rather than isolating one hormone, or even worse, assuming that one hormone is the driver, where it's usually not that simple. As I said, we rarely see increased testosterone as the main driver in our clinic. So if you have inflammatory acne, this is usually more internally driven than topically driven or barrier driven. So if you have inflammatory acne, especially if you're experiencing it in a fluctuating manner, then there can be other things that are also contributing to that. So gut health is one massive component that can contribute to inflammatory acne. Gut health does impact the way that we can process hormones and get them out of our body as well. We do rely on particular microbes in our microbiome to be able to help us actually get rid of estrogen and other things like that. And our microbiome is also quite dramatically impacted by taking the pill. So this can also be a factor, looking a little bit deeper at gut health when it comes to not getting a result from taking hormone medications. There can also be, as I've mentioned, many more complex components to your hormones that are actually contributing to that acne. And when we take out the infamous testosterone, there's a million other things to look at, but people often don't look at them because it is very, very, very complicated to look at women's hormones. And this gives you a little bit of an idea as to how complicated hormones truly can be. So trying to figure this out yourself is ridiculous and impossible. We have spent decades understanding biology and anatomy and hormones and all of the functional testing well enough to be able to look at results like this and be able to really clearly and quickly see what the problem is. But when it comes to hormonal imbalance, there are so many components that tie back into it, like stress, like under eating, like gut health. And it's really important to look at all of the pathways that the body actually goes through to be able to create our hormones so that we can understand what sorts of pathways need support. And in this instance, it may not always be that we're actually working directly on a hormonal pathway to impact your hormones. We might be actually working on a stress pathway, for example, to impact your hormones. So really, really important, I think, to not understand what all of this means, but to understand how complex it is and the importance of being able to cut to the chase and work with someone who actually can figure that out for you quickly, rather than being told everything is fine from blood testing. I'll hand you over to Emily for stress. So stress is also very much tied into our hormone production, as I just mentioned. So Emily Rose will inform you a little bit more about that pathway too.
Yeah, absolutely. So our stress hormones are not always obvious to look for because stress is so subjective. But one of our priorities being clinicians is that we need to do lots of questioning around what stress may look like or be disguised as, and then test certain stress markers. Stress impacts the oil your skin makes, which is why, for example, on a day of higher stress, your skin might feel oilier. And then voluntary stress as well, like a HIIT workout, having oilier skin post exercise. Prolonged and chronic stress can literally change our brain chemistry and even alter the way that we perceive ongoing stress, which makes you even more like wired, and you see more stress, and it reduces your ability to rectify that stress response. An example that Emily shared with me that I love is you're stuck in traffic and then the thoughts start to kick in. Oh my goodness, why is this happening? Why did I drive this way? How long is this going to last? This is going to make me late. This is the worst day ever. My day's ruined. Opposed to, I'm stuck in traffic. Well, I can't control it. I'll put a podcast on to like pass the time. And the big difference here is letting go of elements that you can control versus thoughts that are escalating and then getting stuck on a loop. So like, what are those hidden versions of stress? In clinic, we see a lot of people who are busy, and busyness, it's hard because it's very put on a high pedestal within our society. The busier you are, the more exciting and successful you are, but busyness is still a form of stress, and stress may be one of the big impacts to your skin. As you've seen with the hormone chart, our stress hormones, our sex hormones, like they're all interconnected. So busyness, and it's easy for me to sit here and be like, well, be less busy. And that's what we've got to work together at finding of what moments of peace can we create within your busy routine so that we can tell your body that it's safe for you to heal, because stress impacts your healing potential. And there's no beating around the bush when it comes to identifying those two factors. Stress will impact your healing potential, so we need to prioritize it. It can also cause sleep disruption. It can change your appetite, your digestion, bowel motions, your gut health. Stress is the most fast-acting component to increased gut permeability, which leads in beautifully to our gut health internal driver. Gut health, well, there's lots that we could talk there. Our gut barrier and our skin barrier, first off, they're almost like a mirror to each other, and the gut and the skin connection is so profound. And for like a visual, we want our gut barrier or our skin barrier to be really nice and like really nice and strong. When they start to become compromised, they can become permeable, and you've got all these little gap junctions, and that's where the chaos starts to kick off. So like the skin, it really comes down to how the gut cells and their environment is being fed. So we're looking at the gut a little bit differently to perhaps other naturopaths or other clinicians by making this cellular health our top priority. And this is why perhaps in the past you've taken a probiotic to help your gut, but nothing's really changed because you haven't actually changed the environment you're putting the probiotic into, so it can't colonize. And a really cool like analogy. So let's pretend like suddenly we're all farmers. We have some seeds that we want to plant. Those seeds are the probiotic, and you want to put them in soil, but the soil has to be a healthy environment for those seeds, the probiotic, to actually thrive and colonize. If that soil is disrupted, then the seeds aren't going to grow. So that's kind of a nice way that you can kind of link what's going on and why things aren't working. Now, our gut microbiome, it can also influence and talk to other organs, which is wild. It can literally alter our brain chemistry and make us crave different foods, such as sugar. And it can also talk to our skin. So as you can see, gut health, there's a lot happening. And this is why Emily created the Restore and Renew Gut program, which is incredible. So I highly recommend checking out that resource. But yeah, next up, let's talk about why nothing's worked for your skin so far. We've obviously touched on little elements as we've gone through each of the internal drivers, but number one is really truly understanding your skin type and using topicals specific for you. Not a topical that a friend suggested or an influencer suggested, like something that's specific for you that was chosen by a professional. And I guess a really quick example is we meet so many clients that perhaps describe their skin as being really oily. And that may be the case, but some of those clients actually don't have oily skin. They've got dehydrated skin where they're actually feeling water loss on the surface of their skin, and they're mistaking that for oil. And what it actually means is you need more oil. So we want to obviously help bridge that gap and make sure you're using topicals that are actually targeting oily skin, or perhaps targeting the fact that you have dehydrated skin. Working on understanding your skin barrier. So making sure you're not stripping it away and over exfoliating and using really harsh topical treatments, because when your skin barrier is compromised, like we talked about before, as you can imagine, if you're putting a really active ingredient on a skin barrier that's not strong like this, it's really permeable, that active is penetrating way deeper into the skin than it should be, and it could be creating even more ripple effects of negative adverse effects that you want. You wanted it to help your acne, and suddenly your skin is really itchy and it's inflamed. So picking the timing of those topicals can also be really important. Next up is organ hierarchy, which not everyone talks about, and it's a really interesting concept. So let's say we've determined that you're deficient in zinc. You swallow your new zinc tablet and you want it to go to your skin, but you don't actually get to pick. Your body is always trying to heal, and what it does is it prioritizes the major organs first. Now, sadly, your hair, your skin, your nails are at the bottom of that list. So as you can imagine, if you had a gut issue or there's something going on with your liver, your body's going to prioritize that zinc to address and heal those organs first. And then the leftovers will go to the skin if there is any leftovers. So suddenly it starts to become really apparent, oh, is there other things going on? Because if the internal driver is perhaps my gut and not necessarily that I think I'm deficient in zinc, the treatment plan is totally different. On our end, we're looking at your body in a holistic manner. And that's why our case taking, it's so extensive. It feels like we're asking you 1,000,001 questions. And it's true, because we want to find out about all of those organs and how they're working within your body. But yeah, that would be the summary of why, things haven't been working. And Emily, is there any other ones that you see in clinic that you feel like you've noticed?
Oh, a hell of a lot with supplements and, trying to treat yourself. Yes. So, firstly, I think ensuring that simple things aren't the problem is super, super important. And in free discovery calls that I do with people who are, wondering whether they want to work with us or not, we don't work with people who don't need our help, because we are honest loving people, right? So I'm not on calls just like, yes, definitely book in with us. It's only where I hear that the driver is definitely something that you need professional assistance with that I'm going to recommend that you book in with us. Often I'll be listening to, let me give you a very common example. I went vegan 5 years ago. My skin problems started around that time or within 12 months of being vegan. My skin is like acneic, but it can be a little bit dry as well. Maybe you're experiencing a little bit of dermatitis too, a little bit of pimples around the backs of the arms. My suggestion is not book in, it's go take some essential fatty acids, because a vegan diet is completely deficient in essential fatty acids and is also quite deficient in absorbable zinc. So go fix those deficiencies first. If you still have a problem, book in with us, because it will be a bit more complicated. So really, really important, I think, as a first step, to understand the fact that the skin has very important requirements when it comes to nutrients and minerals that often we're not getting through the diet. So fixing those things first and giving the skin what it needs to be able to function, for some people, especially if you're experiencing mild acne and it's not been, super, super chronic, that can be the simple answer that fixes things for you. And I have had many people where it has been that simple. There is also many people where it's not that simple. And you will know that because you will have probably tried to treat yourself and take a bunch of things from things that you've read. So this brings us also to the component of, okay, I've taken a bunch of stuff and nothing's worked. So why hasn't it worked? When it comes to supplements, your requirements and deficiencies are going to be very specific also to your history. So for example, if you've been on the pill, we need to look at vitamin E antioxidant status, because that is inhibited on the pill. We need to look at your zinc levels. If you don't eat meat, we need to look at zinc levels. There's a lot of things that tell us as clinicians who are trained in nutrition. There's a lot of things like red flags that we listen for that tell us, oh, that's a potential deficiency there. Even down to the fact that Emily Rose is very all over the nutrition side of things, and she will write like prescription plans that are very intense around, you need this one nutrient, here's all the foods that you need to get it from if you want to just work with foods. So when it comes to nutrients, the deficiencies that are present are going to be personalized to you and your history, your diet, your gut absorption of those minerals, a lot of different factors, which is easy for someone who's trained to understand. But for someone like yourself who might just be experiencing the problem and really not knowing where to turn and reading a couple of blog articles, you might find yourself at, for example, zinc or essential fatty acids. So this is a really important conversation to have, because I've gone to the extent of making these products because there is nothing in the retail market that I think is worth touching with a 10-foot pole. So I've jumped through many hoops over the years to actually bring those sorts of items to the market that actually have the right doses and have the right forms of things to create a difference for you. So really, really important if you're taking supplements of your own accord to help your skin. Firstly, if you're taking supplements that are targeted to hormones, like I've seen a lot of these around, where it's like hormone balance powder or whatever it might be. Firstly, do you know what your hormone imbalance is? Because you might be taking something that contains chaste tree and you've got high luteinizing hormone and it's going to make everything worse. Playing with anything when it comes to your hormones, in my opinion, is more detrimental to try to do yourself than to seek professional help, because also you can cause different changes to your hormones as well by taking those sorts of items that then can make it less clear for a professional to actually see what your pattern is. So for example, taking a bunch of chaste tree that you never needed, if we then started working with you because your acne is the worst it's ever been, taking chaste tree, and we see that your luteinizing hormone is like massive, we might be assuming that you have other sorts of issues, but actually that result might be caused by the fact that you've been taking chaste tree of your own accord for several months. So when it comes to self-prescription, I'm not a huge fan of that when it comes to hormones and complex drivers, because you can make the problem worse. Nothing in a retail environment is allowed to be designed to be incredibly impactful to your body anyway. There are very strict rules around what amounts of things and what sorts of things you're allowed to put in a retail product that anyone can just pick up and buy. And the point of it essentially is that it has to have a minimal effect, because the consumer might go and take 6 tablets of it, and we need to make sure that that's not going to actually cause a massive impact on them. So this is also why, when working with professionals like ourselves, you're accessing very strong concentrated items that you otherwise have no way to access, because it's unsafe for someone who's not trained to access those items. So when you're taking supplements, I do have on our Instagram page, we've got a bunch of posts from a while ago about how to tell if your supplements suck, where we talk about different forms and what sorts of forms of nutrients are not absorbable, and what sorts of things to look for when you're actually trying to take supplements to improve your health, which is everyone's prerogative. And I think it's great to be proactive in that regard. But it's really important to pay attention to the dosage of ingredients, and actually what dose is going to cause a difference for you, the form of ingredients, and whether they're actually bioavailable or not. A very common example of this is magnesium. Taking magnesium tablets that say high dose of magnesium, and then you read through the forms of magnesium and it's got mostly magnesium oxide because it's super cheap, and you don't absorb any magnesium from magnesium oxide at all. So we're looking at a completely different product than when we actually understand the forms of the nutrients that are given in the product. It's also important to consider bioavailability and absorption of those minerals or nutrients, which is also a personalized thing. If you have poor gut health, your absorption and breakdown and metabolism of nutrients might be different. If you have liver metabolism issues, then the way that your body can actually use those nutrients is also going to be different. So I wanted to talk through some of the really key nutrients that the skin needs. And this is obviously why I created these products, because I don't want our clinic books to be full of people who just need zinc and essential fatty acids. But often that can be the case if you're not informed about actually what dose to take to elicit an effect in your skin. So when we look at omega-3, omega-3 is a part of our essential fatty acid family. And we do also need vitamin E as well to be able to stabilize omega-3, which is also why I put that into my fish oils, which are, there's only a very small amount of them left, because I'm reformulating the product itself. But when we're looking at omega-3, it's really important to understand that you need a high amount of EPA to be able to actually create a difference to the skin. Now, most fish oil is very high in DHA. Now, EPA and DHA are the active constituents of fish oil. Fish oil that does not have a high amount of those active ingredients is just a polyunsaturated fatty acid, which is actually not that helpful, especially if you have low levels of vitamin E to not stabilize the polyunsaturated fatty acid. Taking a whole bunch of fish oil that doesn't have actives in it, in my opinion, is more detrimental than it is helpful. We need the actives to actually cause a predictable effect on the skin. DHA is more synonymous with brain function, which is why if you're taking fish oil whilst you're pregnant, or if you're giving fish oil to your child, it's very high in DHA because we want brain development to occur. EPA is what impacts the skin and what helps to influence inflammation within the skin and what helps to feed the skin. So it's very important to pay attention to EPA concentration. Now, EPA is not produced very well at all by vegan sources, which is also why if you're taking a vegan form of essential fatty acid, you need to be aware that you're essentially taking a form of omega-6, and omega-6 is more inflammatory because it is pro-inflammatory. It creates arachidonic acid and other pro-inflammatory chemicals. Omega-3, however, helps to offset that. And the standard Western diet is very deficient in omega-3, very high in omega-6. I'm talking like 50 times the amount that we should be exposed to. We're exposed to just through the foods that we generally consume. So if you're taking a plant-based oil, you are not taking any amount of EPA. And I do see this quite a lot in the last couple of months, that plant-based oils are sort of gaining traction. And it's so important to understand that DHA is the highest thing in any plant or algae oil. EPA is not high. There's only very specific species that have even a minor amount of EPA within it. So you shouldn't expect a massive impact on your skin if you're not taking a product that contains the active that works on the skin. And I agree, it's not fair that you need to know all of this to be able to pick a product. You should be able to trust the label, but unfortunately, that's not how marketing works, you know? So when we're looking at EPA versus DHA, we want our EPA to be at a really, really decent range. And we also want our overall omega-3 to be at a really decent range as well. So when we're working with people and prescribing fish oil, we might be looking at using 2 grams of omega-3 for them. We might be looking at using 10 grams of omega-3 for them, depending on their specific condition and what outcome we're trying to elicit. So for example, with acne patients, sometimes if we're under the pump to achieve a result, I'll use super high doses of omega-3 to be able to reduce inflammation and improve complexion of the skin for a short period of time, because they're under my supervision and I can help to control that. So if you've taken fish oil and you're like, cool, that did absolutely nothing, I encourage you to actually look at the EPA DHA content of that product, because when we look at common ones, and these are not even the cheap ones, you can see that the EPA content is very, very minimal when we're comparing what the skin actually requires. I think that the skin requires like at least a gram of EPA a day to be able to elicit any sort of healing response, which is why I made my EFA Pure, which, as I said, is being reformulated, and it's a long story and process to reformulate and create new products. But EFA Pure has one of the highest amounts of EPA per capsule that's available at all on the market. So 650 milligrams, which means that 2 capsules of EFA Pure is giving you over a gram of EPA a day, compared to having to take maybe 4 to 5 capsules of another fish oil to achieve that amount of EPA. So really, really, really important to be looking at EPA content, and for that EPA content to be at least, you know, a third of the amount higher than DHA content. If your fish oil is DHA dominant, you're not going to get the same impact on the skin. So don't be surprised if it doesn't really help. Now, in my opinion, it's also really important that omega-3s are stabilized naturally with an antioxidant, which is why I use vitamin E, because a lot of people are deficient in it anyway, and it's a natural preservative and stabilizer of fatty acids. So ideally looking for something that also doesn't have preservatives like soy lecithin and gross stuff like that to stabilize the fish oil. We ideally want something that is natural and is also giving you added benefits of those antioxidants. Now, the other thing is zinc. So a lot of people are like, yeah, I take a zinc supplement, nothing's changed. Firstly, you shouldn't take zinc for a super long period of time without supervision. When you're taking any nutrient, you are doing it at the expense of another nutrient somewhere down the track, depending on how long you take it for. If you take zinc consistently for 2 years, you might end up with anemia because you're inhibiting iron absorption because you're constantly taking zinc. You know, there is a reason why we have varied amounts of nutrients in our diet, and this is to help to stabilize the amount of nutrients that we're actually absorbing. So taking a high amount of anything does come at the consequence of something else further down the track, especially if you're not deficient in that thing, which is why even when it comes to us prescribing zinc, we do tests to actually understand, are you anemic? Can we give you a high dose of zinc without impacting other things? How long do we give you a high dose of zinc before we'd expect that to change? We just want to ensure that you're not deficient in certain things. And even when it comes to doing that, it can be a little bit complicated. So when we're looking at common skin food supplements, in my opinion, especially once you get to 25 over, where our skin starts biologically aging, which is complete BS, the things that we want a bit more of are collagen supportive items. So things that start to decline in production in the skin naturally as we get older is collagen, hyaluronic acid. And we also do obviously lose more EFA, especially if we're not consuming it, our diet's poor in it, and we're not ever taking supplements for it. So things that we're commonly looking for in a daily supportive supplement are things like zinc, essential fatty acids, marine collagen peptides. Vitamin C is also incredibly important also as an antioxidant. And we want to ensure that we're giving our body as many nutrients as we can, ideally through the one supplement, if that's possible. So when it comes to zinc, we need a decent amount of zinc to impact the skin, but it is important that you understand whether zinc deficiency is a contributor to your skin. There are plenty of patients that we treat who have completely normal levels of zinc, and we don't give them a zinc supplement at all because you don't need it. There are also people who have no other red flags but a zinc deficiency, and correcting that is going to change everything for you. So it's important to understand that the level of zinc that you require is going to be individual based on if you're deficient or not, and also what your diet contains when it comes to zinc and how likely you are to be absorbing that zinc. Zinc from plant-based foods, not as absorbable as zinc from animal products as well. So when we're looking at zinc, generally, in my opinion, we want about a 24 milligram dose a day to be able to give you a really decent amount, which means that if you don't have a deficiency, so important to know if you do or not, if you don't have a deficiency, 24 milligrams of zinc is going to give you enough to serve your other organs and for enough to be able to go to the skin. If you are deficient, I would like double that, sometimes triple that, depending on the person and exactly the other factors that are contributing to that deficiency. When it comes to marine collagen, what a debate. I do have a blog if you'd like to read a bit more about it, because I won't go too deep into it. But collagen, it does matter the form of collagen that you're taking if you're wanting to impact the skin. Bovine collagen, as you can see over here, bovine collagen doesn't really impact the skin as much. Marine collagen is very specific for the skin. It has higher amounts of different amino acids like hydroxylproline, which goes directly into creating more collagen in the skin. It is correct that we break all protein down in the gut into just its amino acids. And that's where sometimes the argument comes from, well, does it matter if I use bovine or if I use marine? It does, because the amino acid profile of bovine collagen is incredibly different to that of marine collagen. Marine collagen is giving you a lot more of the amino acids that you need to actually create collagen within the skin. So very important to know that. Bovine collagen is more helpful for joints and stuff like that. Also depends on the dose that you're taking. So collagen, all of the studies on marine collagen impacting the skin are done on a dose of 2.5 grams a day. If you are buying a product that has less than that in it, then you cannot expect the same predictable outcomes that come from clinical research. So really important to look at those factors. As you can see, a very common brand here, which a lot of people would pick up and think, oh my God, amazing. It says it has zinc in it. It's got collagen in it. When we actually break it down and look at it, this is not going to do anything more for your skin than eating your own fingernails, in my opinion. We've got less zinc in it than if you ate literally anything else. 1.8 milligrams of zinc is definitely nothing to put on a label. And we've got bovine collagen as well. We also have a very small amount of vitamin C. Like, these things are not going to be creating an impact to the skin the way that the marketing of the product is trying to tell you that it will. And on the other end of the spectrum, we look at something that is marketed to healthy skin that literally just has heaps of marine collagen peptides in it. This isn't going to do too much unless you're really focusing on anti-aging or having really dry skin where you need to improve that collagen production. So when I created Formula S2, I did it because I was getting to the end of the treatment process with a lot of my patients. And I was like, you need these few things to just keep your skin healthy and fed. And I actually looked at this product because I was like, that on the label has all the ingredients that I want. Then when I really actually looked at it, I was like, oh, that's going to do sweet FA for you. So I actually went into creating my own product that has all of the stuff that I think people need support with, but doesn't include anything that's going to be problematic if taken in the long term, and also allows for flexible prescribing based on what your needs are. So all of my products come with a very extensive educational product guide about how to actually use that, what the ingredients are doing, what sorts of things can impact the function of those ingredients for you. So Formula S2 actually has a therapeutic amount of zinc in it. So it's got 24 milligrams of zinc when you're taking a daily dose, and that can be flexibly prescribed if you're deficient. It has, as you can see, over 200% of the recommended daily intake of vitamin C, because pretty much everyone needs that. It also has silica to help to support skin and nails. It's got the 2.5 grams of marine collagen, which also leads to quite dramatic nail growth quite quickly. Spirulina to help support all your other B vitamins as well. And I've also just recently added 100 milligrams a day of hyaluronic acid into it, which makes the world of difference if you are over 25. So simple things like this are really, really important to help fill the gaps of simple things that might be creating problems within your skin. The zinc that I use is zinc gluconate, which is a very well absorbed zinc and is very helpful for the skin. Other forms of zinc may not be as well absorbed. And obviously the biggest problem is usually they're not at a relative dose to actually cause a difference for your skin. So if nothing's worked, I hope some of those things are helpful to actually be able to look at the back of the bottles of things that you've bought and understand why that product might not be working. But obviously the biggest question is, do you know what the problem is? Because there are plenty of patients that I treat who've taken the right form of zinc, they've taken the right essential fatty acids, and they still have an issue because they have undiagnosed hormone issues, they have gut problems, they have gut infections, they have fungal acne. So anything they take for bacterial acne is not going to work. If you don't know what the problem is, you will spend so much time and money feeling like you're incurable and like you're the one person who's going to have acne forever. And the question is not what other stuff do I take? The question needs to be, what is driving this? Because that is the only way that you can get an efficient result and the only way that you can truly learn how to trust the process in your skin healing as well. These are people who have been treated in the clinic. So these are all people who started off their journey in the exact same way. I've done a million things. I'm on the pill. I've come off the pill. I've been on the pill 15 times before. I've tried every single topical you can imagine, and now my skin's super damaged by it. All of these people also felt like they were the one person in the world that couldn't be helped. And there is still not a single person that we can't help. And that's because we actually look at what is causing the problem for you. None of these people, which is just a very small handful of people out of the many people that we treat, takes a long time to do before and afters. But all of these people present with the same problem. All of them have a completely different treatment plan, which is why we get results, because the most important question is actually, what is the driver here? That gives you the answer as to what needs support and allows efficient treatment, which I think is one of the most important things to offer when specializing in conditions like this, which are psychologically traumatizing and really impact your self-worth and your self-confidence and how you show up in the world and what sorts of clothes you wear and what sorts of things you see in the world. I remember even treating my sister back here. She used to not even ever look at backless dresses or stuff that showed her chest because the acne was so bad. And you just don't even realize how much someone's life is being impacted by that skin condition. Feeling like you're never going to get help just means that you haven't found the driver yet. And that's why we specialize in what we do, because it's the only way to be able to actually give confidence in the treatment route, because we 100% know what needs support and we can confidently help get you there. So things that we have created that can help you and help you learn more as well. Firstly, my free naturopathic skin appraisal is very comprehensive when it comes to information. It covers some of the information that we've spoken about tonight, and it also gives you an actual idea of what your driver is. I've created an extensive quiz that asks a lot of questions about the drivers that may be present, and it then gives you back a personalized result around what your most likely drivers are, so that you can then start to do a little bit more research around that, or look at a masterclass that we have about that topic, so that you can be more informed, because ultimately the solutions that you're offered depends on how informed you are about the solutions you're trying to find as well. We have a lot of free masterclasses, so some obviously are for eczema as well, but we do have a lot of free masterclasses around different drivers like stress. We've got an extensive masterclass around hormones to help to understand that a lot more and what sorts of testing needs to be done. It even comes with a pathology guide as to what tests should be done, because literally all we want is for people to know what is contributing to their skin. makes the biggest difference in the world to feel like it's a problem that you can solve rather than a problem that eludes you. Other things that we offer is we also do an express skincare consultation, which is focused very much so on the topicals that you're using. So we review all of the products that you're using. We make suggestions around how to optimize that routine so that you can feel comfortable in the topicals that you're using, because often that even becomes confusing at some point in the picture. You don't know if the topicals are making the problem better or worse. So this allows us to go a bit deeper around that route and to be able to provide personalized recommendations or prescriptions for you as well when it comes to topicals. In our skincare consultations, we also do ask you some of the questions that are most important to find red flags as to what other internal drivers may be, so that you can be advised on that and you can do further research or go have other tests done if you'd like. The most comprehensive thing that we do, obviously, is our one-on-one consultations, which are incredibly in-depth. And the supporting material that we give you as well, your personalized care plans, are usually 3 to 4 pages in length. We outline every single driver that is contributing to the issue, both internally and also topically, like what's going wrong with your barrier, what topicals need to change, what sorts of things need to change in your lifestyle, your diet, what sorts of stuff you're going to be taking and why. So this is the most in-depth support that we can offer. And this is always recommended where there is a driver like gut health or a driver like hormones, where it can be quite complex and where you will get further faster with professional support. So there's lots of resources that we have. We also have quite a lot of blogs and articles which are quite in depth as well. I can't help myself. So please check those out, whether they're free resources that you can access through the website to help understand the condition more, or whether it's working with us one-on-one where you don't have to keep doing all of the research on your own and you can just cut to the chase and understand the answers very quickly. Products that we have is obviously the EFA Pure and the Formula S2. I've also in the last year released a skincare range that I've been working on for a couple of years and have used within the clinic for a couple of years to ensure that what I'm releasing is actually helpful and working for people. So this range is called Something Else Skincare because it's a little something else that we give you from the Acne Eczema clinic. This is a botanically based skincare range. It doesn't have harsh preservatives or anything like that in it, but it is important for me to note, and obviously you can tell this isn't me trying to sell you something. If you have a really impaired barrier that is inflamed, some of these items may be too harsh for you, which is also why we are not just giving you Something Else skincare every time you come into the clinic. We will only recommend this range if it's actually right for your skin. If your skin is quite impaired, the botanical components of this range might be a bit too strong for you. If you are already using items like, for example, the Ordinary, which is like horrible and very, very intense when it comes to actives, which can disrupt your barrier even further. If you're using items like that already, then this is a better natural alternative for you that has botanicals that are really targeted to the problem that we're trying to rectify with skincare. So the range that we usually recommend if you have oilier skin is the Regulate range, which has very specific botanicals to help regulate oil production and reduce inflammation and help with improving decongestion, which is important if you're producing too much oil and the oil is not free flowing and is a bit more viscous and more congestive in its nature. There's also a couple of other ranges that I've developed, the Renew range, which is more for anti-aging, and the Restore range, which is a bit more for dehydrated type skin. So often where we're making recommendations of using these sorts of topicals from this range to patients, we might be picking and choosing, you know, a cream cleanser as opposed to a gel cleanser, and then a different moisturizer based on exactly how your skin's presenting and what your skin needs. Because the last thing we want is for you to see us and feel like nothing's changing, right? And that is just simply not possible when we do personalized medicine. So we're taking into account everything that your skin requires based on where you're at and your history, and we're making recommendations purely based on that, not based on the fact that, hey, this is our in-house range. We don't care. If it's not right for you, we're not going to recommend it. So if you are looking at different things you can use from a retail environment and you're otherwise going to go to Mecca or something and get whatever else is on the shelf, then you might be better also looking at Something Else Skincare. and just reading through the different ingredients and what sorts of feature actions they have on the skin as well. I also have written on the website a lot of information about how to use the products in different ways and where I would and wouldn't recommend it for different skin types as well. So I am trying to make the process easier for people to be able to get products they can trust from people that they trust who come from a professional and informed background as well. So feel free to check those things out if you like. The most important thing, obviously, is to remember that there is hope, that if you have not responded so far, then it's because your internal driver hasn't been found, just like all the other women that we have treated and all the other acne that we have treated. So if you currently feel like no one can help you, trust me, it's because no one has taken the time to understand you and understand your drivers and clearly outline that information for you and educate you about how those things are impacting your skin. Once you know those things, then the whole process of committing to a skin treatment program is much easier because you can trust it. You know, you can see the red flags, you can see the test results that prove all of that. We don't play around with guesswork here because everyone's done that before, and that's why we're different. Anything you want to add at the end there, Em?
Yeah, I think, hope is just the biggest takeaway because, like, we get it. Experiencing a skin condition can cause a huge level of emotional stress. And I guess one of the conversations I love having with clients is just really changing the way that you talk about yourself. So instead of saying, I have acne, which just, it sounds so permanent, and swapping it to, I am experiencing acne, which just that one word swap, it feels lighter, it feels kinder, because yes, you may be experiencing acne at the moment, but it won't be forever. And we're here to give you back that hope. And yeah, I truly hope like tonight's masterclass can help provide some of those really beautiful light bulb moments for you. Makes me emotional, like it really does. Yeah.
Totally. I think this is this is such important work just to help people understand that the answer is not necessarily the pill or antibiotics. If it didn't work, like whoop-de-doo, you have more issues going on and you need more support. And people like us are here to help you really uncover those answers so that you can get the help that you need. Because even though you might have the same presenting condition as other people, the route to treatment is entirely different and is entirely based on your uniqueness and your unique drivers, which are all very obviously written in your biology and your lifestyle and your medical history as well. So that concludes all of the information that we are sharing tonight, but we did want to leave some room for questions that you might have. Love to know what sorts of things are popping into your mind, or obviously what sorts of nuggets, like gold nuggets, you've gotten from tonight as well that you may not have seen or heard of before too, so that we can create more content around that. So we'll just leave the chat room open for a little minute for any questions, so we can answer them straight up. But otherwise, we want to thank you so much for joining us tonight.
Absolutely. Thank you for all your time.